Hello everybody, my name is Elaine Sheehan and I am a research midwife at the Day Assessment and Fetal Medicine Unit here at St George's Hospital. I'm currently working on this new project, home monitoring of hypertension in pregnancy. So to give you some background just as to how and why home monitoring came about, hypertensive disorders are complicating 6 to 12% of pregnancies. If we apply those figures to our birth rate in St George's last year, we're talking about on average 500 pregnancies were affected by hypertension. Preeclampsia affects 3 to 5% of pregnancies. For those of you not familiar with the term preeclampsia, it is a life-threatening condition for both the mother and the baby. It's characterized by high blood pressure and protein in the urine. Hypertension is associated with adverse maternal outcomes. So we're talking things like cardiac failure, renal failure, cerebral hemorrhage, and even maternal death. Hypertension is accountable for 8 to 10% of preterm births. This has significant cost implications for the NHS. A recent study has actually found that an estimated £260 million a year could be saved if we could delay the delivery of all these premature babies by just 1 week alone. So when women are diagnosed with hypertension, they're referred to the Day Assessment Unit and we see these women twice a week for appointments. At these appointments, we do a blood pressure profile, which is just made up of a series of 4 to 5 blood pressure measurements. We test their urine for protein. We test their bloods, looking for signs of preeclampsia. And on alternative visits, women will have an ultrasound where we look at the growth of the baby. We know that high blood pressure causes a restriction in the blood flow to the fetus. A recent audit done at the Day Assessment Unit has shown that unfortunately these women could be waiting up to 2 hours at these appointments. So understandably this is very frustrating for the women. A lot of these women will need to take time off work. They need to arrange childcare to attend these appointments. And it's important to note that even though we're putting in this monitoring, a majority of these women will not develop preeclampsia. So as a solution, we propose a new care pathway, and that is home monitoring of hypertension in pregnancy. So our target group is pregnant women with mild to moderate hypertension. These women will be supplied with an automated blood pressure machine and urine dipsticks to take home. The midwives at the Day Assessment Unit, they will counsel and teach these women on how to take their blood pressure measurements. The women will be required to monitor their blood pressure 3 times a day and test their urine once every 3 days. They will then document these readings in their maternity handheld notes, so the next time they come to their appointment, doctors, midwives, we can easily review their blood pressure, see what it's been doing at home. If there's an abnormal result, women can ring or text the assigned telephone number. There will also be an out-of-hours service, so women will always be able to talk to a midwife or a doctor if they have any questions or concerns. Perhaps their blood pressure might just be borderline. Should they come in, should they not, etc. So if there's an abnormal result to be found, these women, they'll be reviewed by a doctor or a midwife. If the review is normal, they can then return home, continue home monitoring, and they will have follow up the Day Assessment Unit every 2 weeks instead of twice a week. So after implementing home monitoring, we're hoping that this should alleviate the anxiety caused to these women and their families. It will contribute to significant cost savings for the women, reducing their transport expenses, reducing the time they need to take off work, childcare costs, and for the NHS, because we're going to save staff time. And currently, staff time is the largest expense for the NHS at the moment. And to reduce the rate of unnecessary medical intervention. So the key objectives of home monitoring are therefore to implement a new model of care to address novel patient care pathways, to empower women to become involved in their own care and whilst enhancing patient satisfaction and experiences as a result, to eliminate long waiting times and to reduce the busy workload for the NHS staff, a cost-saving mechanism for the patients by reducing their transport costs and their childcare costs, a large cost saving for the NHS, and to reduce unnecessary medical intervention and adverse pregnancy outcomes. So we have put together this strict inclusion and exclusion criteria for the women who will be participating in home monitoring of hypertension. As you can see, anyone with severe high blood pressure, significant protein in their urine, abnormal blood results, abnormal growth of the baby, these women will be excluded from home monitoring. Women will be required to speak English so they know what they need to do when they go home. Any women with significant mental health concerns, social issues, maybe women are living alone, they don't have support, or any poor obstetric history, we will also exclude these women. So we're carefully selecting these women simply to maintain the safety of this project and the safety of the women. So to evaluate, after 12 months of running home monitoring of hypertension, we will analyse data from surveys relating to patient and staff feedback. So key questions will include their travel expenses, childcare costs, how long these hospital appointments are now taking, do staff feel that women are complying with their blood pressure measurements when they go home. Cost savings, we will compare both care pathways and see which one is most cost effective. We will look at the time that is saved, and as a result, how can we utilise this time more effectively in the future. And we will look at the rate of medical intervention and adverse maternal outcomes. So we're hoping we might see that there will be a decrease in the induction of these women who present with hypertension. Or maybe women could be referred earlier for adverse maternal outcomes as a result of home monitoring. So to summarise, home monitoring of hypertension and pregnancy is an innovative project. It will contribute to improving patient experiences. It will reduce expenses and improve patient well-being by empowering the women to become involved in their own care. Women will have the ease of monitoring their own health at home or even in the workplace. So majority of women, they're fit, they're healthy, they work up until 36 weeks gestation, which is just 1 to 3 weeks just before their delivery date. Professional advice will be a phone call away, or patients can use an interactive text messaging service to send their blood pressure measurement. So on behalf of myself and my team who helped me to create this project, we would like to thank the South West London Systems for your continued support and your funding. Thank you very much for the development of this project. Thank you.